We have 5 board. And we are now taping in progress. I guess I'm hearing myself over there. So we'll go ahead. We typically have a short meeting in July. At the end of July, there's a basic agenda. And we're gonna let Tricia finish what she's doing.
So is it the TV?
Well, we're hearing an echo before. Still hearing an echo.
We'll get it worked out.
Yeah. And we just need to make sure that Tricia is able to, as the board clerk, is able to function in her duties over there.
Is it the other computer?
We appreciate technology, Sean, right? I mean, it's a wonderful thing.
We are learning. We are learning.
Yeah. So I assume we're not going to modify the agenda, and we'll get to public comment shortly once we're ready to go. But welcome Nicole and Sean and Kelly and Chris for making the effort to be here tonight, so we can have. There is some business that we do need to do on the district's behalf. And Tricia, you can let me know when you're ready. Are we good? Good. All right, Sean. We're next item on the agenda is public comment period.
We have 2 people. My apologies. We have 2 people who have signed up. First on the list is Aaron Hayden. Hope I pronounced that correctly.
I believe Tricia at that. Yep, at that podium. Excellent.
Testing.
I think you're good.
Hi, good evening. I'm pretty nervous because this is my first school board meeting. Thank you all for serving. I just moved my family here recently. Last month we arrived on the 21st. And the area that we left to move here, we felt that this area in this school district would be a very healthy environment for our children. And so far, we've heard great things, which thank you very much. Recently, we've all heard in the news about new guidance with masks, mask mandates, what schools are going to do. And I read that on the 12th, you decided that mask mandates would be required for children in schools in this district. And I was hoping that the data available on the CDC website would be looked over a little bit harder because it does not support masks for children anymore. And I'm just here to voice my opinion. And I've looked at the data and I support the data, and it does not show any reason for kids to have masks anymore. So I just want to say that. Thank you very much.
Thank you.
Up next, we have Dr. Pei Soinka. And not seeing Rob, that's all the folks who have signed up.
Anyone else wish to speak at this time that's here in the room? And then, since this is your first board meeting, the public has 3 minutes to speak, and however many people wish to speak, they can do that. Then the board has an opportunity to respond if they wish. And so we're in board responses. Go ahead.
And this is less of a response directly. I would presume that during our presentation later on this evening that there'll be an update about reopening, and I would imagine part of that would be addressed. And I'm looking at our Deputy Superintendent, Lily Talcott, to see if that's the case. So I'll hold off on that response, but I do want the community to know that given that the governor has lifted the state of emergency, and as our board president, Rob Ainsley, has stated, that we are required during to be in compliance with open meetings law and open governance to have our school board meetings in person, that folks who wish to address the board will be required to do so in person, or they can send notice in advance to our board clerk. And so I just wanted to make sure that that is available for our community to know. We've also posted that, and we will continue to make sure that that is available and sent out to the community as well.
Thanks, Sean. Anyone else right now? And it won't take us long to get to the presentations, so, and we look forward to an update on reopening from Lily and the team. So if no one else wishes to speak, we'll move on. Chris, you don't need to speak, right? But Chris, you can talk soon, all right? So the student reps, they're not up and going yet. And so let's just roll into consent agenda. There's several items that were added. There was no finance committee. And so Amanda, perhaps once we move and second this, you can just speak to a few of these things. So if we could have a motion and then we can consider.
I'll move the consent agenda as presented.
Second.
Second by Nicole. Thanks, Chris. Nicole. And Amanda, I know that there was a walk-on, well, a week or so ago, about a few things. If you could just give us an update and we'll move on.
Absolutely. Thank you, everyone, for your time. I'm Amanda Verb. I'm the Chief Operations Officer for the district. The consideration of accounts, oftentimes, as Rob said, goes through the facilities or finance committee. We did not have either during the month. So there are two things. One of them came from the technology department. That's resolution 6.1 for classroom technology, library automation, and other instructional technologies. This is really the domain of Zach Lind, who is our Director of Technology or Chief Information Officer. And essentially Zach's description, and I'm sorry, but I'm just going to read it because this is a language that I don't speak. And so I think I feel better just sort of being the reader. It is for the replacement hardware of our internal server environment. This is a hyper-converged solution for virtual storage and files and computing. And in parentheses, it says virtual appliances like Continuum for HVAC or Aruba for the Wi-Fi. So those that are much smarter than me, they know what that is. But really, it's really for our infrastructure, right? So, so we run that through the OCM BOCES, which houses the RIC, which is the Regional Information Center. And so that's 6.1. And then for 6.2, you all know that we're doing a capital project, which was voted on by the public in 2019 for $120 million. Every year, we also do what's called a capital outlay project. And a capital outlay project is just that. It's monies that we put forward toward capital, but capital outlay projects have different restrictions to them. They have to have a maximum amount of $100,000. They have to happen only at one building, and then that aid, when that project is completed, is returned to you in that same year. And so you'll see for 6.2, what we're trying to do is have the capital outlay project for the current fiscal year approved, as well as our planning for next fiscal year. And if you've been tuning into any of the facilities committee meetings, you will know that we are really focusing on the safety of our large instruction spaces, specifically our gymnasiums, that still have the portable or the walls that actually you turn the key and then they close, and they're solid,
right, motorized
partitions.
Right.
Thank you, Rob. So we are removing those, and we are using draw behind curtains instead.
Thanks, man. Any questions on those items? Obviously, as we read the consent agenda, there's a long personnel report, which we would expect this time of year. And that's fairly self-explanatory, I believe. Any other questions? Anything else?
Rob, no, I'll just add that it is a long personnel report, and I'm excited to welcome a number of educators to our community and to thank our coaches and advisors for various clubs that they help support our students with. So we don't get an opportunity to do that pre-school year, so we'll do it now, or excuse me, during the school year. So thank you and welcome to all the new teachers who are coming our way.
Would I be able to ask a question about item 8, the recommendation for student placements from committees, subcommittees on special education?
As long as it's not specific.
Yeah, no, I just want to know what it entails.
I'm happy to do you want to speak to it, Dr. Brown, or you want me to speak to it?
Yeah, go ahead, please.
Every board meeting, for the most part, as part of the consent agenda, we get a copy of the services that are provided for students either with 504 or IEPs. And this is a listing of those services that are provided for students. And we get an update on those I believe every board meeting. If not, it's every board meeting, correct? So Lily or Mary, I think, did I capture that correctly, appropriately?
Thumbs up from the gallery on the left. So that's their spots. Apparently, I found out that's their spots in Culp Auditorium. So it's all good. Any other questions? Thanks, Nicole. Kelly, you good? Anything?
Thumbs up.
We'll keep rolling through. So it was moved by Chris, second by Nicole. All in favor? And we just show our hands. That's everyone. And so, Dr. Brown, your turn.
Oh, thank you for the opportunity, as always, Ms. Ainsley. I'm going to quickly transition to my team because I know we have some other agenda items, and much of my updates are going to be embedded in those presentations. And while they make their way to the mic, I do wish to say there's a significant amount of excitement and energy in the air as we have young people back in our buildings. Project Innovation is underway, and look for an invitation to some upcoming celebrations from me or Mary or Lily, wishing that you would come to one of the closing ceremonies of sorts. But again, great experiences, but joy to see our young people in the space and engage in the way they are. And a big shout out to our educators who are doing amazing work, welcoming, affirming, and educating our young people. Thank you.
Thanks, Dr. Brown. Lily.
Wonderful. Hello. Good evening, everyone. It's good to see you all. Thanks so much for having me. As promised, we are providing an update around reopening our pre-K through 12 schools here in Ithaca. And so I want to just provide, although we don't have a ton of new information, I want to make sure that the community and the board knows really where we stand, what's remained the same, and what's perhaps shifted. Thank you so much, Tricia. All right, so you may recognize some similar slides from our June 22nd presentation. If you wouldn't mind going to the next one. I think it's key that we start with and make sure everybody remembers that in the ICSD, we plan to cultivate connections by welcoming all staff and students back in person for the 2021-2022 school year. So it's really, really the mode that we're planning to move forward on. And there are a number of updates, some even from today, that we thought it would be important for you all to know about. So today, literally a few hours ago, the Centers for Disease Control and Prevention recommended universal masking in schools for the fall, regardless of vaccination status. And so that's something that they have just recently put out, which is different from what they had put out recently. I believe one of our community members alluded to that as well, and that was previously what they had stated. And now they're recommending something different, right? The data changes, they're being really responsive, and so it's important for us to really watch what the CDC is doing, but it's also important for us to know that there is still no new guidance from New York State, right? The most recent information that we received was a couple of weeks ago, indicating that we had the choice to adopt the summer camp and daycare guidance, or we could keep on doing what we were doing. So the July 12th masking shift that you see on our website is that we're essentially keeping everything the same. So masks outdoors are optional, masks indoors are required in the presence of students. And if adults are vaccinated in adult-only spaces, they have the option, right? That's optional. It's also important to note that since the last time we met a month ago, the CDC has put out information that they believe it's paramount to have in-person teaching and learning, even if not every single layer of each mitigation strategy or non-pharmaceutical intervention can be in place. So for example, if physical distancing is an impossibility, right, then ensure that all of these other layers are in place, right? So ensure that, there's masking, that there's good hand hygiene, that you're doing screening, perhaps even surveillance testing, et cetera, right? So So that's an important piece for our community to know and the board to know. It's also important to know that our vaccination rate here in this county is one of the highest in the states in the nation, right? So we have 68.5% of all eligible county residents who've received the first dose and 65% who've received 2 doses, which is extremely high. Also, since the last time we talked, it's important to note that vaccines for those under 12 are expected midwinter, and that the American Academy of Pediatricians has urged universal mask wearing in school. So those are some things that kind of lend themselves to us further planning for the fall. Tricia, if you wouldn't mind going to the next slide, please. And so the last time we talked, we really were working with the most stringent guidance to plan really prudently. So the classroom, again, we are anticipating and making sure that everyone can fit comfortably, right, at 6 feet apart. Or, I'm sorry, 3 feet apart for learning, 6 feet apart for eating, singing, playing wind instruments. Masks indoors seem very likely. Testing for unvaccinated individuals. These are all things that we know we have to plan for because they take a great deal of thought, right? And so we want to ensure that we're ready if these are all required. If they're not, we can simply take them away. I just want that to be noted because, again, we don't have guidance. However, if remote learning is also required, we will simply follow the guidance, right? So of course, we're planning for in-person, but we'll follow the guidance if required. Right now, we're anticipating that those non-in-person learning exceptions will be for those who have COVID-related medical needs, right? Those contraindications that make it challenging to be in school, reviewed by an ICSD medical panel. So we've assembled that panel, we're beginning to meet with them. We're moving forward with all of that. And just as a reminder, Tricia, if you wouldn't mind going quickly to the next ones. For elementary, they would be multi-age classrooms for non-in-person, synchronous and asynchronous. And unless a student's medical situation changes, it would be a year-long commitment. So we're planning for a year-long, but if they are ready to come back, that's fine. At secondary, it's really going to be more temporary. Asynchronous learning through Canvas, and they'll have access to school-based tutoring in person or remotely. So what's the process going to look like for non-in-person learning? There will be an initial application. It's online or paper. People can call, access it online, et cetera. And then a licensed provider would need to complete an eligibility form. And that eligibility form would then be reviewed by this medical panel that we've assembled. So this is really similar to what you will see and read about in San Francisco and in Chicago as well. So some other big cities that have already put out their processes that we're in some ways modeling ours after, but of course, making more responsive to the Ithaca community. So although we don't have much clear guidance in writing, we thought it would be still helpful for you all to have an update. Any questions, thoughts, things that I missed?
Just to be clear, Lily, some of our practices we're modeling on what they do in Chicago? Is that what I heard?
So Chicago and San Francisco have both put out very clear overviews for their processes for those who have specific COVID-related medical needs.
Oh, okay.
And so we are using their, it's nice not to have to create something from scratch, right? So we can simply use a model and then adjust it to really meet our community's needs.
Right. I was just looking for clarification on what we were modeling coming out of Chicago. So
yeah.
I probably would have some issues with the total public education system in Chicago. So
No.
Thank you for the clarification. So just to reiterate and be clear, there will not be an educator in this district that will be teaching. They will all be teaching the children in their classroom. There will be no hybrid option or responsibilities for any educator, correct?
That's correct, right. We're not doing the simultaneous or concurrent distance and in-person teaching and learning experience, correct.
Right, so when we see asynchronous and, that wording, that does not mean there will be, a hybrid classroom in this district. There will be, remote is one thing, and that will be hopefully rare, and in just a few cases, we expect with 3 feet that there is room in this district for every student to come back and every educator to be back in the classroom.
Yes, and we're planning for, and again, this is all in preparation for, knowing that we still don't have guidance from New York State, 3 elementary classroom teachers to provide remote learning or non-in-person learning experiences for 3 multi-age classrooms. Right. And the service providers that will be working with them as well.
Go ahead, Nicole.
I was wondering what the
Can you speak into
process.
the mic? Sorry.
I was wondering how you all are managing open enrollment. Thinking about schools like Northeast that's usually busting out at the seams, and the 3 to 6 feet away. Are we going to be saying no to, do we predict to be saying no to more people this year?
Yeah, that's an excellent question. And the answer is yes, and we already have. So we moved up our open enrollment date a few years ago. So it's June 1st now. It just allows us to plan better for really welcoming and holding students, making sure that we have special education providers appropriately staffed at each of our schools, right? So we really know who's coming and we can be appropriately prepared to welcome them. So we typically accept a large number of these. And Dan Bryman, I'm sure, would be happy to get us the final numbers. I'm happy to send those to the board as well. And so if we weren't able to get people's first choice, maybe we got their second or third. And in some cases, we just weren't able to simply because of space. Yep.
I have a couple of quick questions. I hope they're quick questions. One, I want to restate what I heard, and partly what I know is that from last year, we constantly remind folks that this is changing, as Dr. Brown has often said, usually by the minute, if not the hour, if not the day. So earlier today, the CDC just released new guidance and new recommendations, both for schools and for public spaces, and for particular folks, depending on where they may find themselves in terms of health need. We are also, as a school district, in conversation and directed by New York State Department of Health or New York State Education Department, which may differ and or add more stringent recommendations than the CDC does, and we may not be allowed to go outside of those recommendations. And if I'm saying anything wrong at any point in time, please correct me, Ms. Talcott.
You've got it, Dr. Eversley Bradwell.
And that we are also in conversation under the guidance of Tompkins County Health Department. So there are 3 layers of health departments that we are in collaboration with, but also take guidance from in terms of how we operate our school district. So I know that there are times that there have been parents and caregivers who are asking why we weren't doing certain things, and we had to say, it's not our decision, right? So it wasn't something that we had local decision to decide. It was what was mandated, and that same thing may happen here. And whatever is decided today on, I don't even know the date, July 27th, is that where we're at?
Yep.
Well, pretty good. May not be the same thing that happens the first week in September when we start opening schools. And so it'd be important for the community to know that piece. Second, I know that we have another board meeting in August, and I would presume that there would be an update at that point in time as well. But I am wondering, how are we communicating to families, particularly during the summer when a lot of folks aren't paying as much attention, even while they have great concerns about the opening of the school year? Are we in constant conversation and communication with our families? Have we been providing updates, emails? I know we put it on some of our social media, but I'm just wondering what our communication plan is.
Yeah, we had a call from a number of folks, educators, families, students, to actually give folks space for much of the month of July. So we've heeded that call and that wish. And as we know more and as we begin to really finalize many of these, we plan to communicate through social media, through our website, through our lovely evening Zoom webinars that, that we plan to have, also through snail mail as well. And so we've begun transportation planning. You know, we did put that out about a week ago, asking families to indicate their transportation needs so that we could start planning much earlier. I think the community can probably bet on more communication beginning in August.
Thank you.
Other questions for Lily and the team? All right, Chris, Kelly. Anything else, Dr. Round? No, we can talk later. We good? And then we're going to have health and wellness update from Carrie, which will be helpful as well. Okay.
Thank you all.
Thanks, Lou.
Hello, good evening. My name is Carrie Burke. I'm the coordinator of health services and wellness for the district, and I'm pleased to be here this evening with this opportunity to talk to you about school health services. We ready, Tricia? Yeah, excellent. So this is the first of what I hope to be an annual opportunity to talk to you about what occurs in the school district around school health services, and in particular, what our school nurses do to ensure the health and safety of our school community. Just for framing purposes, I don't know if you've seen this graphic before, if you're familiar with the whole school, whole community, whole child model. It's nearly a decade old, developed by the CDC and the Association of Supervision and Curriculum. And the idea was to more fully engage both education and health in the work of ensuring positive health and academic outcomes for students. You'll notice that there's a figure of a student in the center. It is student-centered and emphasizes the role of the community in supporting the school. The connections that exist between health and academic achievement are well established, as well as the importance of utilizing evidence-based policies and practices. This model has many components, but for this evening, I'm just be focusing on health services. When we think about health services, the nurses, there's a common refrain about this being so much more than ice, lice, and Band-Aids. I know that health services evolved significantly since the time I was a student in public school. Health services are designed to ensure that students, first and foremost, are ready to learn through intervention with actual and even potential health problems. This includes providing first aid, emergency care, and assessment and planning for the management of chronic conditions like asthma or diabetes. In addition, there's a focus on wellness promotion and preventative services that touch students as well as staff and parents. These services are designed to ensure access and referrals to healthcare providers, something very important as we're coming to deal with the implications of health disparities. These services connect the school to the broader community, so there's many elements of care coordination. Our nurses are frequently in contact with healthcare providers, families, and other members of the school community. The idea behind health services is to facilitate and support the ability of students and families to adapt to health and social stressors, such as chronic health conditions, or maybe a pandemic, and economic barriers. The idea is to build capacity to manage these stressors and advocate for their own health and learning needs. So as the only medical provider in a school building, school nurses play an integral role in bridging health and education to improve each child's cognitive, social, emotional, and physical development. School nurses were central to our school reopening efforts in the county. Their knowledge and training were elevated and sought after as we faced an unprecedented pandemic. And their contributions have been celebrated and recognized with the Community Hero Award, which is sponsored by the Tompkins Chamber and Tompkins Trust Company. And as you can see, the comments from Dr. Brown, the nurses' work has really reflected our mission and vision, and they helped us to uphold our values in a very difficult and challenging time. One thing I do hope, again, to put in front of you on at least an annual basis is data. With the use of electronic student health records, we have greater capabilities around describing the work that occurs in the district around health services in many ways, including numerically. What this chart shows, and this is the only data I'll be showing this evening, is health office visits. I started with the district in the middle of the 2018-2019 school year, and you can see over 180 days, we had nearly 30,000 health office encounters. So that's a child walking through the health office door and receiving services or support from a school nurse. That's pretty remarkable. And I would hazard to say even a little underreported, because certainly there are students who visit the nurse's office and are not there necessarily for any clinical care, but really for comfort and companionship and support. As you'll notice in the middle column there, or the middle figure, the 2019-2020 data is truncated, of course. We were nearly at 20,000 office visits, but of course the year was cut short. And then this last year, the dramatic effect of the pandemic, and of course, having some students learning virtually and some students being in person, that those visits really fell off. In preparing to speak with you, I did reach out to the nurses and ask them to share with me stories, experiences that they've had in the district, which I think are important to highlight because they tell the story behind the numbers. And so this particular example, I think, really points to the alignment with, again, with the district's mission to engage, educate, and empower students. So if you don't mind, I'm just going to read this out loud. Throughout my school nursing career, one of the favorite specialties to work with are students with diabetes. Their care can be complex, with blood glucose monitoring, carb counting, insulin calculations, and administrations. I spend time educating myself on all the necessary information, communicating with the family, student, and their healthcare providers. Working together, we successfully manage diabetic needs, keeping students safe and healthy at school, and fostering relationships in the process. Because of good teamwork and communication, we can avoid diabetic emergencies at school. Newly diagnosed students can be very dependent on school nurses for diabetes management. I do a lot of education on counting carbohydrates, calculating insulin doses, and reviewing signs of hypo and hyperglycemia. In time, students are frequently able to self-manage their diabetes to function independently in many aspects of their care. Having had the benefit and privilege of seeing nurses in action, I can tell you it doesn't just apply to those students with chronic health concerns. There are students as young as kindergarten and first grade who walk through that health office door, and the nurses, rather than doing, are working alongside them, instructing them, hand washing, applying a Band-Aid, guiding them through the process, encouraging them to be knowledgeable and to be forceful advocates for themselves. And of course, I would be remiss not to address all the work that nurses did with respect to COVID-19 and school reopening. So even as office visits may have dropped off, they picked up a multitude of additional responsibilities. They included symptom screening for students who were either not screened at home by their caregivers before arriving or during the course of the school day who felt unwell. It also included managing isolation rooms for people or individuals who are feeling unwell at school, contact tracing and case management for students who were sent home and then identified as having been exposed and needing to quarantine or being positive and being isolated by the Tompkins County Health Department. Lots of outreach and education. Certainly, they fielded a multitude of calls from parents and staff members as well. As has been acknowledged, the information was constantly evolving. We were learning a lot as time passed, and nurses were central to answering people's questions and addressing concerns. And then lastly, something I think incredibly remarkable too, never did I imagine that we would become a limited service laboratory and would engage in surveillance testing, but we did just that in the middle of the school year. And over a 6-month period, we conducted over 6,500 tests. And those were for students and staff. I love this image. I loved putting this together. It made me think about the work that our nurses do, not just in buildings, but in the community. So going from the top left there clockwise, one of our nurses who works in the for Cayuga Health System, serving our community outside of the students. Then the gathering of the nurses at the end of the school year, but it was a wonderful celebration of the work that had been done. Nurses volunteered to sew masks up at Cornell or even in their homes. We had a nurse here, Cheyenne Cardamone-Newstep from Beverly J. Martin, who decided to get involved in an after-school program called Girls on the Run. Nurses were central to vaccination efforts, again, answering questions and helping to facilitate the school-based clinics that were conducted by the Tompkins County Health Department. And so with that, just briefly, something with respect to the upcoming school year, something we can anticipate. So $2.5 million in funds were allocated by the federal government to establish COVID testing programs in Tompkins County schools. So we can anticipate that there will be support for and funding available to do testing, and the proposal now is to do diagnostic testing for symptomatic individuals. And it would look something like this. If a student were to be directed to the nurse's office and they had what we assume is a symptom that, or we identify a symptom that is affiliated with COVID, that if we have parental consent on file, we could collect a sample right then and there before sending them home. These samples would then be picked up and processed by a lab with results provided in 24 hours. They would be diagnostic PCR tests, and the idea around this is to reduce out-of-school time, to mitigate the spread of COVID, and to alleviate barriers to testing, whether they be transportation or the limited hours at a testing site. We did see over the course of the school year some students who had longer absences or periods away from school than really we would have liked, in part because parents couldn't get to a testing site or they had to schedule a time the next day or even the day after that. So this is going to be designed to eliminate some of those barriers. So there'll be more information coming on that, but I will pause, and if you have any questions, I welcome them.
Questions for Karen?
I don't have a question, but I actually just have a statement. I'm forever grateful for the nurses, especially Nurse Barb at LACS. My son is a type 1 diabetic. He has an insulin pump. He was diagnosed a couple of years ago, and Barb was just fantastic. She really took any worry that we had out of the equation. We knew he was safe, and I actually laughed. She had to text me when he started in the summer program because she was like, "Do you have his supplies?" And I'm like, "Yeah, we put the box somewhere." So she's on top of it. I mean, she reminds us to give her the things that she needs, and she's just forever grateful. They're wonderful. So I thank you all.
Thank you for sharing that.
Anything else?
I would just echo Kelly in terms of Nurse Cheyenne at BJM, who has been amazing to all three of my kids over the years in terms of just providing emotional support or checking in with me to let me know that one of my kids is having a hard day because their best friend isn't there, and it's outside of the medical realm, but she's caring for the whole child, and I've always appreciated Cheyenne.
Thank you.
Ms. Nicole?
Kelly and Nicole are going to force me. I have to give props out to Nurse Patty at Enfield, who has also done the same for our grandbaby and has been amazing. And I always wonder and am in amazement how folks find enough time in the day to provide care and text or email or call while providing care for a whole school full of young folks. And similar to Nicole said, oftentimes with our grandbaby, it's not medical related. It's just she stops by just to say hello and get a hug. So that's above and beyond all the amazing medical things. So thank you, and please share that with your team.
I'd be happy to. Thank you very much.
And just before you go, Carrie, there's a fair amount of funding from the feds, stimulus relief, and it's been pushed out to communities and school districts. And part of it was the testing, but also there was, there was money to provide supports, and certainly in the health and wellness area. I know we have plans in place to utilize those funds. I mean, Lily and I think Carrie, you've talked about that. How will our nursing services, or how will that health and wellness, how is that going to look different than what it was in 2019 before this? And I say this also from, we have folks coming back to work and adults coming back to work they're being encouraged to 2 days a week, slowly getting reacclimated to going to work and going in. And I tell you, I've been there the whole time, but they're struggling a bit. So as we do go bring everybody back, how do you envision a very busy nurse and what other supports are going to be there? If we could just flesh that out a little bit, that'd be great.
It's a wonderful question, and I will attempt to answer, and if I don't, please let me know. I think one thing is that if staff in the building and if parents in that particular school community didn't know their nurse, they do now. And so I do expect the nurses to be fielding quite a few questions about health practices and safety concerns. And I'm encouraged by the work that nurses have done and the way that they've been elevated with their nurse school community, that they're working hand in glove with building administrators. So I think much of the work would be happening as we lead into school, and then of course throughout the school year. The administrators have done a wonderful job of integrating them into all sorts of spaces, whether it's parent-facing, community-facing spaces, as well as within staff meetings. I would say the other thing is the nurses have proved themselves to be very resilient and flexible. I think that's evidenced by the fact that we stood up a testing program rather quickly. And I think that's what's going to be required of them even in this school year. The fact, for example, that the CDC is pivoting on their guidance around masks, I think is illustrative of what we have been experiencing and can expect to be experiencing going forward. The nurses also provide, as you've seen here with the stories, there's a lot that happens in the data, and then there's what we know to be happening on the ground. And their spaces are, in their practice, are good indicators for what's happening in the school community. So it's having that dialogue with their building leadership and with myself to understand what the needs are, and then mobilizing quickly to respond to them.
Thanks, Karen. Anything else? Thank you. Well, we'll hear more, Carrie, from you, as we have throughout the past 2 years now, almost. So a few more items before we can wrap up. And Sean, you just want to walk us through the advisory council appointments and reestablishment of those councils?
Yes. After a conversation during our organizational meeting in the first week in July, there was a conversation about whether or not we should continue the 3 advisory councils that we have established. The advisory councils are under the auspices of a board policy, which mandates that each advisory council should state what its purpose is. And they are in existence for a year, and of course can be reapproved or reestablished. Those conversations, as they're all in the same motion, one would be a reestablishment of the Code of Conduct Advisory Council, which 2 weeks ago, completed a 3-day intensive writing workshop is probably the best way to describe it, and even while there's still more work to be done. Also, the reestablishment of the 2019 Capital Project Community Advisory Council, which has been working in collaboration with the Facilities Committee, and the reestablishment of a District Early Childhood Advisory Council to continue our work with building partnerships for early childhood education. So after that conversation and taking feedback from board members, the goal was to reestablish all 3 advisory councils. You can see their missions either in board docs or on your form. And so that's where we leave ourselves. We will assign board members. Each advisory council will have a chair. That is to be determined by the advisory council. There is no one set who's to be the chair, and that there would be reporting back out to the board within a year about where the advisory council stand or the work that was conducted, and each of these have given presentations previously. So with that caveat, I move agenda item 11.3, advisory council reappointments for adoption this evening.
Second.
So by Chris, any questions or comments? You got Nicole? So Chris, Kelly Reed, short briefly.
That's the next one. That's 11.4.
I'm good then.
We good?
Yep.
Okay, all in favor? That's everyone, thank you. And then on to 11.4, audit committee appointments. And I'll let that be moved and seconded, and we can speak to it if we need.
I'll move agenda item 11.4, audit committee appointment members, as stated on the agenda.
Second?
Second by Nicole. As Sean, since he's all things policy and committees and all that, the audit committee is the only committee that is actually required by New York State that started about 15, 16 years ago. There were issues down in Long Island. There's always issues in Long Island, Sean, that we have to deal with. But since then, it is required that we have an audit committee that is comprised of board members and then community members, and they have to meet 4 times a year, and also really manage the auditing by an outside auditor of the school district and its finances and its functions. And so, and that very important committee, and it's always, we always appreciate 2 folks from the community that agree to be on it. There's no glory in it unless you really like audits. Frankly, it was where the audit committee was where we kind of found out where the money was 15 years ago, and it's but it is actually very very helpful. And we appreciate that Don Waddell, who's been on the committee for quite a while now, and Ann Ryson, who's a recent board member, have agreed to serve on that committee. And so we appreciate their willingness to serve. For you know, I would point out there's not even cookies or anything at these audit meetings. There is no food, no nothing. It's an audit committee meeting. You can't buy anything, right? So it's bring your own. Okay, I grab a bottle of water from somewhere in there, but it's so we appreciate their assistance and willingness to serve. So unless there's any questions, that's kind of quick. We're good. It was moved and seconded, and Nicole seconded. All in favor? That's everyone. And the last item is athletic merger with Montessori for modified sports for 21-22, fairly routine. It is also a file attachment with the application. It has to be signed and filled out correctly, and as far as I can tell, it is, and it's gone through the athletic department. It is for modified sports. We do not have cuts in modified sports. There's just, there are a few kids that are likely to be future modified and Ithaca High School athletes. And so we are more than happy to encourage anyone and everyone to be active. And so we're happy to at least move this, and then we can vote on it. And it is for all sports, but typically it's going to be for several of the popular ones. And that was the explanation. I didn't move it because I don't move things, so, right?
I'll move 11.5, athletic merger with EAC, Montessori Schools Modified Sports for 2021 and 2022 school year.
Thanks, Chris.
I'll second.
Second by Sean. I already gave a brief description. Any questions?
No questions. I'll just say, Kelly, this was a long-standing conversation in the community about athletic mergers. I can go back and find some of the minutes and some of the agreements that we have made about what does it mean for Ithaca City School District students, with acknowledging that it's still a single community. But this has been an ongoing conversation, and as Rob indicated, any merger goes through our athletic department for approval.
Yeah, no, I think I'm okay with that.
And it typically comes down to hockey.
Yes.
Everything comes down to hockey in Ithaca, just so you didn't know that, but this is for modified sports, and there's no modified hockey in Ithaca right now. So moved, seconded, and all in favor. And that is everyone. And so really, anything else that we need to touch base on? The issue of masks is ongoing. I am vaccinated, and I wear a mask rarely now, but when I'm in a school building, I'm going to be wearing a mask, whether I'm vaccinated or not. It's a fluctuating, flexible, ongoing conversation about whether masks are good or not, whether they're effective or not, how they're worn. This has been an imperfect solution, I would have to say. But glad to talk more. We will be talking more about masks as the guidance continues to change, and so we're glad to talk more about it with community at any time. Upcoming dates, unless there's no other business tonight, but we do have 2 meetings in August. The next is August 10th, I believe. Will be another voting meeting, and we will start up our committees in August at some point. Certainly, finance and facilities have to meet toward the end of August, and then there will be the others. Sean and policy and that never-ending work that you all do, and curriculum, et cetera, and HR. Obviously, we're hiring all the time, so look for some work in August, but also look for an opportunity to enjoy a little bit more summer here. It has gone by way too quickly, as I keep telling myself. As I don't take any vacation, so I might have to do that before too long, or otherwise it never happens, Sean. That's what I'm told. So,
True story.
So Dr. Brown, I forgot about you, Dr. Brown, down there. Are you, you have anything to say, Dr. Brown?
Keep on forgetting, I'm good.
Okay. And it's great that you had a lot of outstanding educators come from around the country to hear about what we're doing here over the weekend, I
It's the
think.
best place in the country to be in the summer.
Exactly, exactly. So I'm glad that went well. Nicole, anything? You good?
I'm good.
We're gonna wrap up. And I think we're gonna go. Chris?
Was there a further conversation or question? I didn't want to ignore you.
My apologies. This is the part that I keep saying that I don't like about Robert's rules, is that it prevents conversation. But as soon as the meeting is over, I'm sure a number of us will come have that dialogue to make
Okay,
sure that
I
happens.
just wanted to make sure we acknowledge that.
Right, it's the way the meetings go, but we try to be extremely open, but we're glad to talk shortly. As soon as somebody ends this meeting, and, oh, wait, that's my job.
Yeah.
It's, Kelly, if you're good, we're gonna wrap up. So thanks, everybody, and we're gonna go ahead and let everybody go. And I'm gonna go see if it's raining out or whatever. So thanks, everybody, and thanks for the folks who are making all this stuff work. And thank you, Tricia.